For joining today. Before we begin, I would like to invite us into a brief moment of arrival as we are coming together from different places, roles, and experiences. So, if it feels okay, let's take 30 seconds together. Just notice our breath, not changing it, not controlling it, simply observing it. And gently notice your body, your energy, your sense of ease or tension in this moment. So let's actually take a position, and if you prefer to close your eyes, you're more welcome to do that, or keeping your eyes open, it's up to you. So it's up to your comfort level. So only focuses on our breath. Breathing in, feeling the sensation of air touching your nose, and flowing the air, positive energy as well into your body. And as you're breathing out, feel the air running out of your nostrils, all that bad gases in your body and the bad thoughts along with that, and the bad energies along with that, flowing out through your nostrils. Now repeat that one more time, breathing in, and now breathe out for longer. 1, 2, 3, 4, 5, 6, 7, 8. Now breathe in for 4. 1, 2, 3, 4. And breathe out 8. 1, 2, 3, 4, 5, 6, 7, and 8. Well, this isn't an exercise to fix anything, just to listen to your body, only to your mind voice, and only to your thoughts, and only to your breath. Your breathing has a sound, so listen to that. Now, I believe everyone has appreciated your own breath, because very often health begins with awareness before action. Now, take a moment thinking about your own experience or the people you support. Which of these has felt most challenging recently? Breathlessness or changes in breathing, blood sugar fluctuation or cravings, digestive discomfort or gut sensitivity, low energy or fatigue, stress, overwhelm, or poor sleep. So your 30 seconds begins now. You can drop your choices, whatever picked up in the chat box, or you can keep it yourself. So it is a moment to understand what is your perspective. 1, 2, 5, 4, 3, 2, and 1. Thank you for taking part in this, and I hope that you'd have actually identified your choice, and that will create a little bit of your awareness of your and curiosity of what you're expecting from this webinar today in this space. What's interesting and more clinically important is that many of us would have chosen just one. Breath, blood sugar, digestion, and stress rarely operate in isolation. They overlap. What may feel like separate symptoms are often expression of the same underlying regulatory systems, the autonomic nervous system. And that overlap the shared physiology beneath these experiences. And this is exactly where today's conversation begins. When nervous system is dysregulated, breath becomes shallow, blood sugar becomes unstable, and digestion becomes reactive. So in this webinar, I'm going to explore and take you along the nervous system as a central regulator, not a separate system, but one integrated neurophysiological network. There is more to it, and you'll be surprised of what we have been aware of this particular concept of nervous system integrating our breath, blood sugar, and our digestive system. So let me now introduce myself. I'm Dr. Devi Sundar, an integrative mind-body consultant. And my work sits in the intersection of respiratory health, mental health, neuroscience, Ayurveda, and integrative care. Over 2 decades of clinical and academic practice, I work with people, majority of the people, chronic respiratory disease population. And I've also seen that they have been struggling with these comorbid conditions, metabolic conditions, and digestive disorders. And the emotional burden they carry along with this trio integration is so hard to see them struggling. So, what I have consistently observed, both in research and in lived clinical experience, is that these conditions rarely exist in isolation. People don't come with just breathlessness, just blood sugar problems, or just gut symptoms. They come with fatigue, inflammation, anxiety, disrupted sleep, and fluctuating energy, and a sense that their body is no longer working in a whole congruent. Yet our healthcare system still treats them as a separate condition. So I hope that I will not disappoint you to understand and renew our thought process and the way we approach our body systems, disease and conditions in an integrated way. I would like to introduce to our nervous system, which has least attention when it comes to conditions like chronic respiratory disease or blood glucose levels, diabetes, or IBS. The gastroenterology part of it deals with it separately, but without actually understanding, or maybe it is in a blind spot to the clinician that physiologically these are regulated by one integrated autonomous nervous system, ANS. When this system is chronically dysregulated, symptoms intensify across the systems. So, who's this webinar for? Individuals living with diabetes, type 1 or type 2, people with chronic respiratory disease like COPD, asthma, or long-term dysfunctional breathlessness, IBS, bloating, or gastric reflux, and clinicians, nurses, physiotherapists, psychotherapists, GPs, and health coaches, and also the educators and the community leaders. So what you will gain at the end of this webinar, you'll be able to understand clearly the autonomous nervous system regulation and how it controls all the three systems. And you'll be able to recognize stress impact, see how chronic stress alters breath, glucose, and digestion, and also able to learn regulation tools like evidence-based nervous system regulation practices and identify patterns of dysregulation patterns in your own physiology and practice reset strategies. So you live with a practical 3 minutes nervous system reset. So why this webinar matters today? I would like you to fill with the numbers because our brain is more understanding when we see the real crisis around the globe and in UK. 537 million adults live with diabetes and 1 in 10 adults affected globally according to that figure. 1.2 million people being diagnosed with COPD in UK, and that is rising with age as well, and third leading cause globally. And 40% of them globally have digestive disorders, and 140,000 COPD hospital admissions, annual admissions in UK, and 97% of them are emergency admissions. And the recent Biobank UK study revealed the bidirectional relationships of IBS, irritable bowel syndrome, increases the type 2 diabetes risk by 18 to 32%, while the metabolic syndrome confers that 24% higher COPD risk. These conditions share the inflammatory, metabolic, and nervous system pathways. So research consistently have shown that there is an overlap. People with diabetes are nearly twice as likely to experience depression, and up to 40% of the individuals with COPD experience clinically significant anxiety. IBS and functional digestive disorders are strongly associated with stress and autonomic imbalance. So what connects them? That's the nervous system. Chronic stress increases the risk of metabolic syndrome and drives symptom overlap across the condition. And in this slide, I would like to take you what happens in the body during chronic stress, particularly through the lens of survival physiology. When the brain perceives a threat, whether it's a physical danger or a psychological stress, the HPA axis activates the hypothalamus pituitary adrenaline axis. And this system coordinates our hormonal stress response. As a part of that activation, we release cortisol and adrenaline prepares us for immediate action, that like rising our heart rate, blood pressure. Cortisol works more slowly but sustains the stress response. One of the cortisol's key role is glucose mobilization. It signals the liver to release the stored glucose into the bloodstream. This gives us a quick energy to deal with that perceived threat. At the same time, the body shifts resources away from the system that aren't essential for immediate survival. That's why we see digestive suppression. Gastric emptying slows, gut motility reduces, and blood flow is redirected away from the digestion. And the breathing pattern also changes. Many people develop a rapid upper chest breathing, sometimes leading to hyperventilation. This keeps the body in a state of heightened alertness. Now, looking at the evidence, Bruce McEwan's allostatic load model helps explain how repeated or a chronic activation of the stress response wears down the body over time. We also know that cortisol directly increases the hepatic glucose output, supporting the energy demand model of stress. And research shows stress reduces gastric emptying and gut motility, linking the chronic stress to digestive complaints. And finally, studies on hyperventilation syndrome demonstrate how chronic rapid breathing patterns can reinforce the anxiety, dizziness, and physical discomfort. So, what I'm trying to pitch here, and I want you to take away, is chronic stress is not just a psychological experience, it's a full body survival response that, when activated long term, can significantly impact your metabolic, digestive, and respiratory health. Now, let's zoom out and look at the systems coordinating much of what we have just discussed, the autonomic nervous system. So what is the autonomic nervous system and what its function is? The autonomic nervous system regulates the autonomic functions of our body, like heart rate, breathing, digestion, blood pressure, and even some aspects of our immune function. So it has two primary branches, and the first one is sympathetic nervous system. This is our mobilization system, the classic fight flight response. When activated, the heart rate increases, breathing quickens, and glucose is released into bloodstream, and digestion slows down. So it's designed for our short-term survival. And second is the parasympathetic nervous system. This is our restoration system, often described as rest and digest. It supports digestion, tissue repair, immune function, and energy conservation. When this system is active, heart rate slows, breathing becomes deeper and more rhythmic, and the body shifts to a recovery mode. I've discussed this in my educational videos in my channel, Breathe and Thrive. So you're more welcome to watch those videos to get more information on this concept. And so let's go back to this webinar, the slide here. So the key player of the parasympathetic nervous system is the vagus nerve. So the vagus nerve is a major communication pathway between your brain and your body. It integrates the signal between your breath, heart, gut, and even the inflammation in many ways. It acts as a regulatory bridge between your psychological and your physical health. So I've introduced the evidence on a slide. Stephen Porges, the polyvagal theory, expanded our understanding of how vagus nerve influences emotional regulation, safety perception, and social engagement. Research on vagal tone shows it's important in metabolic regulation, inflammation control, and resilience to stress. And another important variable, that is the heart rate variability, HRV, is widely used as a measurable marker of autonomic flexibility. Higher the heart rate variability generally reflects a more adaptable nervous system, one that can shift efficiently between your mobilization and restoration, between your sympathetic and parasympathetic activity. So the key takeaway here is flexibility. Health isn't about being permanently calm or permanently activated. It's about the ability to shift appropriately between your sympathetic and parasympathetic activity. What is the villain here? Chronic stress. Chronic stress disrupts that flexibility, and that's where many long-term health consequences begins. Now we move to one of the most powerful and accessible tool we have since the day we born on this earth, the breath. Breathing is not just a mechanical process, it's a real-time mirror of the nervous system. First, what breath reveals? There is a big difference between diaphragmatic breathing and apical or upper chest breathing. Diaphragmatic breathing is slower, deeper, and driven by the diaphragm, which is a era of our inspiration, that is taking in that oxygen from the external sources. Apical breathing is shallow and rapid, often associated with stress and sympathetic activation. Our breathing also regulates the carbon dioxide levels. Many people think oxygen is a key driver of breath, but carbon dioxide regulation is actually critical. When we hyperventilate, we blow off too much of carbon dioxide, which can lead to vasoconstriction, which means narrowing of our blood vessels, and symptoms like dizziness, tingling, or anxiety is indication of it. We also have chemoreceptors that monitor CO2 levels. In chronic stress, these receptors can become more sensitive, meaning even small changes in the carbon dioxide can trigger a stress response. So this creates what we call as anxiety breath feedback loop. So stress changes breathing. Altered breathing lowers our carbon dioxide levels, and low carbon dioxide then increases our physiological arousal, and that heightened arousal feeds back into anxiety. So now the encouraging part here is the evidence-based benefits. Research shows that slow breathing increases our vagal tone, supporting the parasympathetic activation. Breathing at around 5 to 6 breaths per minute has shown to optimize our heart rate variability, improving our autonomic flexibility, which I mentioned earlier. Just 10 to 20 minutes daily of slow diaphragmatic breathing can significantly improve your heart rate variability over time. There's even emerging evidence from a small randomized control trial suggesting that diaphragmatic breathing may improve glycemic control, likely through reduced sympathetic drive and improved metabolic regulation. So the key takeaway here is breath is both diagnostic tool and an intervention. It reflects the state of the nervous system and it gives us a direct pathway to influence it. Unlike many interventions, it's free, portable, and immediately accessible. So I believe by now you've understood blood sugar regulation is deeply autonomic. Chronic stress can raise this cortisol, increasing your blood glucose level and leading it to an insulin resistant state. And autonomic neuropathy in diabetes further disrupts the gastric emptying, heart rhythm, blood pressure regulation. And the glycemic variability also affects your mood stability. Many individuals report anxiety during hypoglycemia, not psychological weakness, but physiological response. So the key here is to understand is the nervous system is the centrum. And when we look into the digestive function, the gut contains over 500 million neurons, often called as a second brain. Stress reduces gastric secretions and slows the motility. In other words, it accelerates the transit. So chronic stress alters the microbiome diversity in our gut. IBS and functional gut disorders are strongly linked to the autonomic imbalance. So digestion requires to feel safety. Yeah. So again, then your nervous system plays a key role in activation of the parasympathetic, and telling your digestive system that you're safe is very, very key. You cannot digest in a survival mode. So in a nutshell, our breath, blood sugar, and digestion are more integrated, and all are regulated by our autonomic tone, inflammatory load, emotional safety, and behavioral rhythm. Now, I would like to take you to evidence-informed regulation practices, how to build resilience through your nervous system awareness. So regulation doesn't require complexity. So it has only 5 foundational practices. Number 1, slow breathing, 5 to 6 breaths per minute through diaphragmatic engagement. Number 2, congruent breathing, equal inhale and exhale, for a certain duration. For optimal equal inhale and exhale for a certain duration will improve the heart rate variability. And third one is a gentle movement, post-meal walking to moderate glucose response. And number 4 is consistent routine. Predictable sleep-wake cycle reduces your cortisol variance. And finally, number 5, relational safety, connection. Connection increases the oxytocin and vagal tone. So safety is the medicine. So oxytocin releases through safe connections, and that supports the parasympathetic activation. So why these practices work and why I'm telling you today. Evidence suggests that 10 to 20 minutes of slow breathing improves the heart rate variability. Post-meal walking reduces postprandial glucose spikes by up to 30%, and consistent sleep-wake rhythms reduces cortisol variability throughout the day. Social connection through safe relationship increases oxytocin release. So that's it. And so there you go. There is evidence for those 5 foundational practices which you can adopt from today. And especially I would like to point out here during a long exhalation as a key practice that stimulates vagal tone, creating a cascade effect in the nervous system. And small shifts then compounds over time. And this is the way you train your nervous system becoming aware of the regulation of parasympathetic recovery. So I would like to introduce trauma-informed and culturally sensitive care and the 4 pillars of it, adaptive response, because we cannot actually regulate our body system in a survival mode, and we need to go into a safety mode. So survival physiology is protective, not pathological. So, but it is actually then leads to more of breathlessness, glucose dysregulation, and digestive systems that reflect, and digestive system and digestive symptoms that reflect adaptive response to stress. So phase regulation is something which we wanted to adapt to. So that makes us to feel safe. Pushing intensity before building capacity can trigger further dysregulation. So start where the nervous system is, not where we wish it to be. And cultural context, food traditions, family systems, and lived experience matter. Culturally responsive care honors what nourishes people beyond macronutrients, identity, celebration, and meaning. And finally, the fourth one is of avoiding shame, shame around the glucose levels or weight versus a sympathetic activation, constantly being in that survival and anxious mode. We work with physiology, not with the blame. So the nervous system responds to safety, not criticism. So we have to be very well aware of these four things if we wanted our body to function in an integrated, calm way. So let's practice. Take a comfortable position. We are going into the 3-minute reset now. So now place one hand on your chest and the other on your abdomen or your upper belly. Now gently inhale through your nose for 4 seconds or 4 counts. 1, 2, 3, 4. And exhale slowly through your mouth 6 seconds or 6 counts. 1, 2, 3, 4, 5, 6. Now pause gently at the end of your exhale and then repeat for 2 to 3 minutes. So this is the structure we are going to follow. So get another cycle going on. Inhale gently through the nose for 4 seconds or 4 counts. 1, 2, 3, 4. Exhale slowly through your mouth. 6. 1, 2, 3, 4, 5, 6. Pause gently at the end of your exhale and then repeat again. Inhale through your nose, 4 counts. 1, 2, 3, 4. And exhale slowly through your mouth for 6. 1, 2, 3, 4, 5, 6. Again, inhale through your nose for 4. 1, 2, 3, 4, 5. And again, inhale through your nose for 4. 1, 2, 3, 4. And exhale through your mouth for 6. 1, 2, 3, 4, 5, 6. Pause gently at the end and repeat. Notice your breath without trying to change it while doing this practice. Allow exhale to lengthen naturally. While you're doing this exhalation for longer, remember, and tell your mind it's stimulating your vagal tone. Maybe a little prompt will also help your brain to remind activation of your parasympathetic system. And then observe any softening in shoulders, abdomen, or jaw. Now you can practice this for 3 minutes, and as the time concerned, we are moving on to the next slide. So I would like to touch on the key points on building the consistency in this practice. Regulation over intensity. So small daily practices reshapes your neural pathways more effectively than occasional intensities. And small daily practices reshapes your neural pathway more efficiently than occasional intensity. And micro practices daily, 3 minutes, several times a day, might build the capacity better than a one long session in a week. And pattern awareness, track your breath, mood, glucose, and digestion patterns without judgment. Co-regulation matters a lot. So healing happens in relationship and rhythm. So we regulate in connection. So these are the key things you have to remember to build consistency. So consistency reshapes your neural pathway, and small daily practices are more powerful than occasional intensities. Now it's a time for a reflection. I want you to take a moment and reflect on these questions. When do I notice my breath change? This actually reflects your sensitive movements, which then reveals your autonomic shifts. Number 2, what stresses precede glucose spikes or digestive discomfort? Just to remind, patterns link nervous system state to metabolic response. And number 3, Where in my day can I build safety? So here in this question, I want you to identify the windows for breathing, movement, or connection. And number 4, what does regulation feel like in my body? Noticing that shift, noticing the felt sense builds, noticing your felt sense builds introspective awareness. Noticing the felt sense builds introspective awareness. So why I want you to reflect all this? Because understanding your nervous system response is a key foundation for sustainable change. These practices support your metabolic health, digestive function, and stress resilience through nervous system awareness. Now, the next question for your reflection. Which of these experiences resonate with your work supporting clients with behavioral or metabolic health? Breathlessness, glucose fluctuation, digestive discomfort, stress, or overwhelm? Take a moment to reflect. Now we move on to the next one. So a quick check-in. Right now I feel calm, alert, anxious, fatigued, overstimulated. Which one of that you feel right now? Be honest yourself and take a moment to pull that, whatever you feel. And also focus on my breathing is shallow, deep, fast, slow, irregular. So which one of that your breathing falls? And the next one to reflect on, mapping your patterns. Blood sugar patterns. I notice spikes when eating specific foods, after interrupted sleep, during high stress periods, following missed meals, when sedentary, or any other thing which I've forgotten to mention here. So tick the box or mention it there in the other section there. And moving on to your digestive symptoms. Symptoms worsen when eating triggers, stress is high, sleep is disrupted, dehydrated, taking certain medication, or any other thing which you feel is not there mentioned there. So this is all about mapping your patterns, becoming aware of your patterns without judgment. It builds the foundation for sustainable regulation. Consistency reshapes your neural pathways, so healing is relational and rhythmic. This is a very important key thing I would like to remind you. So you can practice a 3-minute reset, as I mentioned earlier. And otherwise, you can also do it as a breath art. And I've given that infinity breath art there. So you can actually trace or doodle along the infinity with a color pencil or a pen or a crayon, whatever color materials you wanted to use. And focus on longer exhale because it activates your natural calming response. So start at a one point at the end of the infinity, and as you breathe in, and then go to the other end, and then start the breathing out. And your infinity will outgrow, because I want you to focus on a longer exhale as you're doing the practice. It's progressing. So because long exhales activate your natural calming response and gently signaling that safety. So that's what we wanted to activate here and get aware of your nervous system. This is one of the nervous system retraining activity. And it's also fun and interesting and engaging. So you can actually practice this. So after your practice, notice your physical sensation, whether you get any tingling or warmth or heaviness or lightness, and any changes in your temperature or tension. And then observe your breathing as your breathing becomes slower, deeper, or more regular. Notice, notice any natural changes. And also check your state. Do you feel more grounded, calm, energized, or relaxed? There's no right or wrong way here to feel, but whatever you feel is that what we wanted you to understand and your nervous system to understand, so that you can actually correct it or regulate it. Remember, each practice may feel different, and curiosity matters more than achieving a particular state. So once again, I wanted to remind you the signs. Slower breathing with long exhalation gently stimulates your vagus nerve, which travels from your brain to your major organs. And this reduces heart rate and blood pressure whilst increasing your heart rate variability. These changes signal safety to your brain, shifting you from an alert state towards a calm regulation. So, with consistent practice, your body learns to recognize and return to regulated states more easily throughout the day. So this is a plan map I've given, and you can actually print this out and stick to wherever you wanted to keep as a reminder in your own home or office. So choose one small practice to commit to daily. Consistency matters more than perfection. 5 minutes slow breathing as a regulation practice you've learned, and gentle walk after meals, movement that supports digestion and regulation, and consistent sleep routine, regular bedtime and wake time supports the rhythm, and screen-free wind down time. So reduce the stimulation 30 minutes before you sleep, any kind of gadget. Yeah. And relational check-in. Share how you're feeling with someone you trust. So whatever practice you choose, just write it down with the date so that you can actually also see the consistency, what you're building up in this practice, and how you actually change in relating to your body and who you trust. So I want you to work this out for you. So anchor to existing practices. Practice after brushing the teeth or before meals or after work, the breath practices. And start small. 2 minutes counts and build gradually as it feels manageable. And track with compassion. Note what you did without judgment, what you didn't manage. And for the clinician, integrating the autonomic education into your daily practice is a key because your patients or clients need to understand their own physiology. And that's why we have learned the anatomy and physiology in our education system as a foundation, whether you're a physiotherapist, whether you're a nurse, or whether you're a medical doctor. So explain the physiology to your clients or your patients. Understand that symptoms arise from nervous system state, not personal failings. And teach simple regulation tools, share breathing techniques as part of managing symptoms and building capacity. And monitor with curiosity that tracking changes in sleep, digestion, and energy alongside the clinical outcomes. And also, finally, it is very key that you create safety in consultation, ways to reduce shame and increase safety. Validate that symptoms make sense given what the body has experienced. Emphasize that regulation is physiology, not a test or a measure of worth. Invite clients to notice what they can feel without requiring particular outcomes. And offer practices without pressure or expectation of perfect adherence. So, finally, reflection of this webinar. What felt most relevant today for you? Which insights or practices resonated most with your own experience? And I also want you to reflect on the next question on the slide. How might you bring this forward? What small commitment you make to support your nervous system if you're a patient, or to your patient if you're a clinician? And now the floor is open for any questions. You can type in the chat box. I'll be keeping an eye on that. And case reflections and post-webinar reflections will happen with a extra session based on the demand. 10 or more requests, we have a discussion session on this webinar as a learning thread. So finally, the key takeaway I would like you to take is nervous system sits at the center of everything, your breath, your blood sugar, and digestion. One nervous system working to keep you safe. So when we restore healthy rhythm, we restore the foundation for all functions. Finally, we have come to the end, and thank you for being here and being more engaging with your practices in this webinar earlier. Our next webinar is on the 24th of March, World Tuberculosis Day, and our title is Living with Breathlessness, Fatigue, and Digestive Distress at 10:30 a.m. UK time. And that webinar is also streamed live on my YouTube channel at Breathe Thrive with Devi and also on my LinkedIn. And for those who would like to get a lifetime access, you need to register, and I'll be circulating the link for the registration. And finally, you can go and visit to our website, tele-therapies.org, or our CIC Mind Body Synergy, and our Facebook, tele.therapies, and our YouTube channel, Breathe and Thrive. So thank you again. Finally, have a good day.